Good morning, it's Andy Prothero and Llewellyn from PCR Global and Fit for Purpose. Go on in, mate, get on. Where are we? We are down Lacher Estuary. This is a place I grew up, it's not far from the house. And I just want to talk about the health and safety policy very, very quickly. For those who are on our up-and-coming health and safety risk management for security managers course, the policy, we can be focusing a lot on the health and safety policy from a security perspective, of course. And what's there to say? What are we gonna cover? 3 parts to a policy. That first part is the statement of intent, and quite often people think that is the policy. No, that's the statement of intent. It needs to be in 3 parts. Statement of intent, often signed, of course, and endorsed by the senior person in the organisation. Then we're going to have the responsibilities, or what some people call the organisation. It's not the organisation as the name, it's how health and safety is organised within the company. So quite often it's useful to call it responsibilities. Responsibilities of who? Responsibilities of senior managers, responsibility of, could well be security managers, responsibilities of, so up to the organisation. But you should be saying who is responsible, who is responsible for certain areas of health and safety requirements within the company. The third part is the arrangements, and that could be anything from A to Z. It could be asbestos, right up to zoonosis. But within that part, for me, right at the start, we're going to be looking at assignment instructions, because for those involved in security, assignment instructions is the agreement you've made with your client of how you are going to deliver your security service. And what is a security service? Well, it's protection from malevolence. So ultimately, that security service, especially those guys and girls on the ground, you are potentially paying them to, I say potentially, you're paying them to respond, or I should deter, detect, delay, respond, assess. We know the principles of security, but ultimately, you're paying them to respond, what's that? To a potential attack, aren't you? That's what you're doing. And ultimately, to do that, then you're going to put yourself in harm's way. So there's going to be some decent discussions there on the use of force. And if you're abroad, depending on which organisation you're working for, that could be lethal force, up to lethal force. Exactly that, so it could be that. So it's going to be an interesting discussion around the health and safety policy. But it's really important as health and safety managers that you know how that affects you, because you're on the front line of safety, really, aren't you? You are having a say. You are having the say how things are organised, how they are planned, and how they are executed. So health and safety is a large remit of the security manager. So that's it. A lovely, beautiful morning. As always, stay safe, stay healthy, and when you can, stay productive. Thanks for watching.